This video is intended for those new to setting up for a 180-degree bed turn where the surgical field will include the head, neck, and chest. These include Dr. Singal's DIEP flap cases. You will first need some extra supplies. 2 anesthesia circuit extensions, 2 15mm multi-adapters to connect the circuit extensions, a flex connector and a straight connector, several MaxGuard 60-inch IV tubing extensions, 2 4-foot pressure monitoring extensions to extend the arterial lines, several extra tourniquets to use as ties, 3 packages of blue foam. The ventilator circuit extensions can be found in the anesthesia supply room in the North Tower here. The 2 15mm internal diameter multi-adapter connection pieces can be found here. Be careful to not accidentally take the 22mm adapters, as these are kept nearby also. After intubation and securing of the ET tube, multitasking can begin, which may include central line placement, arterial line placement, and additional peripheral IV access placement as needed. It should be noted that the decision to place invasive central venous or arterial lines should be based upon the clinical condition of the patient, as they are not routinely needed to monitor flap perfusion. Make sure to communicate with the surgical team prior to any line placement to ensure they will not be in the surgical field. Then the bed can be turned 180 degrees. The ventilator circuit can temporarily be connected as shown while basic monitors are reconnected. The blood pressure cuff is shown on the patient's arm in this depiction, but can be placed on a lower leg as well. Care must be taken to position the EKG pads outside of what will become the surgical field. In this example, we have run the right-sided EKG wires under the patient's lower back and then placed them as such. At this time, the patient's arms are moved to almost 90 degrees with foam padding added as shown. Extensions for all peripheral IV, arterial lines, and central lines can be added at this time so that their ports will be accessible after the patient is draped. Here is what the circuit extensions will look like connected in line. The CO2 sampling line should also be extended using one of the 60-inch IV extension lines. The ventilator circuit shown has the flex connector and straight connector in place. A blue towel can be placed around the patient's eyes and head. You may also apply eye protection goggles as shown if they are available. Blue foam can be added to provide a platform for the ventilator circuit as it is passed over the top of the patient's head as shown. The circuit is then reattached. The metal L-shaped circuit holder can be placed to hold the circuit in place, with enough extra circuit length in place to accommodate elevation of the head of the bed if needed by the surgeon. The circuit can then be tied to the bed rail along with IV tubing and patient monitoring lines as shown. Here is the finished appearance with all lines and ventilator circuit tubing out of the surgical field and off of the floor. At this time, reconfirm that all lines are accessible and functioning and that arterial lines have been zeroed prior to surgical draping.